Regarding the radiotherapy, there is a proper algorithm to be followed. When you do the lumpectomy and then you have to go for standard radiotherapy, if you have done the lumpectomy and you have to put your patient on a standard radiotherapy, then you have to be very sure about the resected margins. If the resected margins are free, then there is no need for the extra radiotherapy. But if you see there is a focal ductal carcinoma in situ, then go for a re-resection. And if there's invasive cancer, then obviously you have to go for the boost radiotherapy. And if the tumors are beyond the focal disease, then you have to go for a re-resection. And if you do the mastectomy and there is invasion to the chest wall or skin, then you have to give the chest wall radiation. And if there is a radical surgery and the axillary lymph node was greater than 4 centimeter, then obviously you have to go for the radiation. You don't have to go for the radical surgery. Okay, so then you have to go for the radiotherapy. Now, if there is a sentinel node and there are isolated tumor cells, then obviously you don't have to. You just have to do the lymph nodal resection, and you don't need to go for radiotherapy. But if there is a micrometastasis, then you have to go for a radiotherapy. And if there are macrometastasis, then obviously you have to go for the radiotherapy. So even you do the lumpectomy, it depends upon the margins, okay? If the margins are free, don't go for radiotherapy. If there is a focal disease or there's invasive cancers, then you have to put the patient on a radiotherapy. For the mastectomy, if there's invasion to the chest wall, go for the chest wall radiation. And if the axillary nodal size is greater than 4 centimeter, or the lesion is about greater than 4 centimeter. And then sentinel nodes, isolated tumors, there's no need of radiotherapy. But in case of macro metastasis, then obviously you have to go for the radiotherapy. So this is the algorithm in case of the lumpectomy, mastectomy, and the sentinel node, where the radiotherapy you have to follow.